assumes importance or helps you in your day-to-day practice. We, the ADA committee members, after spending at least 2 years in the council and going through a lot of disciplinary cases which we get against the registered medical practitioners, we found there are few correctable things which we can suggest or we can enlighten our registered medical practitioners so that they will not do this repeated mistakes. This topic, do's and don'ts of RMPs, will be useful for you in your day-to-day practice. So I welcome those who have joined. And the speaker, Dr. Murunathan, is the convener of Tamilnadu Medical Council, one of the government-nominated members, and he needs no introduction, but it's my duty to introduce this pan-Indian star, who was the API president, who was IMA president, who was LATN Medical Council president, and whatnot. And his love on academics is unparalleled. He does a lot of CMEs, and after conducting a lot of disciplinary meetings, he felt that it is our duty to show some enlighten our RMPs so that they don't do repeated mistakes. Now over to Dr. Murunathan, sir.
Thank you, Dr. Sivaram Kannan, our expert panelist, Dr. Prabhagar, Dr. Srinivasan, Registrar, Dr. Kamraj, and my dear brothers and sisters. It gives me immense pleasure to speak to you on a very, very important topic today. And I'm very happy to convey Doctors' Day greetings to all of you, because we doctors have a lot of struggle problems, and in spite of our sincere service, sometimes we get into some problems because of small lacuna, small deficiency. And I think the Tamilnadu Medical Council has taken an initiative to educate the registered medical practitioners on what to do and what not to do. And this will be very useful whether you are a registered medical practitioner or a cardiothoracic surgeon or a super specialist. So let me start my talk. Facilitating unsung heroes. The Tamilnadu Medical Council values the dedication and compassion of medical practitioners. Overcoming challenges with resilience. We recognize the challenges we face every day, and we want a peaceful and supportive environment so that we'll have an embarrassing bright future. As usual, when you do a presentation with legal importance, we have to give a disclaimer. This presentation is intended for only educational and informational purpose only. The content provided is not a substitute for a professional legal advice. Always seek the guidance of your legal advisor with any question or concerns you may have regarding the Code of Medical Ethics. You may also contact our Tamilnadu Medical Council, the mail ID will give, as say case by case, because things may differ. But I want and urge every one of you to learn the basic medical ethics so that you will have a peaceful practice. What is professional conduct? Professional conduct is the manner in which the RMPs practice with their professional capacity. The core principles of ethics, there are 4 pillars of ethics. One is autonomy, non-maleficence, beneficence, and justice. The objective is to ensure high standards of the medical profession. What is autonomy? The name itself says the right of the patient to make informed decisions about their health care. The key points in the autonomy are: you must respect the patient's personal freedom, informed consent, importance of providing full information on medical condition and treatment options. So every practitioner should follow this to respect his autonomy and also to make him understand what he's got and what we are going to do. Beneficence is the obligation to act in the best interest of the patient promoting good and preventing harm, providing effective treatments, ensuring patient comfort and safety. Non-maleficence means do no harm, avoiding unnecessary harm or suffering, careful consideration of risk and benefits, minimizing potential harm in medical intervention. Justice, fairness, and equality in healthcare. Equitable treatment of patients, fair allocation of healthcare resources, addressing disparities in healthcare across. So these are the main 4 pillars of ethics: autonomy, non-maleficence, beneficence, and justice. What is confidentiality? According to the regulation, I think most of you would have possessed this medical ethics book when you signed the registration in the Tamilnadu Medical Council. If you don't have, please download the medical ethics, and you should have that in your clinic. The regulation of 7.14 says maintain confidentiality and privacy. Regulation 7.15 says patient information only with concern or when legally required. You are not supposed to reveal the patient's history to everyone, even to their attenders, unless you get the consent from the patient. Informed consent 7.16, obtain informed consent before any treatment. You know, it's better, it's prudent to write the informed consent, ask the patient himself to write in his own language so that it will be more valuable. Because sometimes you write in English and ask them to sign, it may not be good. So make him understand, let him write in his own handwriting. Regulation 7.17 says, ensure patients understand the risks, benefits, and alternatives. Make sure you explain everything. If possible, you record that also. Because tomorrow, when you do everything, the patient may deny that he did not understand, he signed blindly. So you should have documentation. In every practice, everyday practice, don't forget about documentation and also recording. That's very important. Professional competence, 1.13c says, engage in continuous professional development. You know, that is why all of us, we have to undergo continuous professional development. The NMC has advised 30 credit hours so that you can update the knowledge. That's why our Tamilnadu Medical Council also encourages people to do this, and we give credit points. Regulation 1.23, stay updated with the latest medical advancements and practices. What you learn when you are a student is different from what you are doing now. So I think you have to update the knowledge. That's very important. And then some key regulations for RMPs, non-maleficence, I already told you. 7.18, avoid harm to patients. 7.19, provide treatment that are in the patient's best interest. That's why I said you have to possess this book, Medical Ethics. If you don't have, you can download. We'll send you in the PDF form. You can keep it in your clinic. Honesty and transparency. Regulation 1.2.2 provides truthful information to patients. You should be truthful to your patients. And 7.20, disclose any conflict of interest. And respect for patient autonomy, I already told you, respect patients' rights to make their own healthcare decision. You should not force any decision on the patient, and patients should take their decision. You must make him understand and get the informed consent, and then proceed with your treatment. Regulation 1.13 supports patients in making informed choices. You have to give 3-4 choices when you have different choices for a particular disease, and make him understand, let him give the consent. And then very, very important regulations in RMPs. We as ad hoc committee members and disciplinary committee members come across so many problems in the area of certificates. See, when I say certificates, you issue medical leave certificate. And when you give medical leave certificate, certain norms you have to follow. And when you give fitness certificate and about death certificate, also life certificate. We were surprised, Sivaram Kannan and Prabhar, we were talking, because every week when we go for disciplinary case, 2 or 3 cases come only on the life certificate. See, it is necessary for a person to get a life certificate for land transaction or insurance claims, all that. It is not that doctors should give life certificate. And if you want to give life certificate, you have to follow strict procedures. And unless you know them very well, my suggestion is try to avoid giving life certificates. Though you are very much interested in helping somebody, you should not get into problem. So recently, I tell you an example. One of the senior specialists has given a life certificate. And the patient was there, he signed the certificate and he has given. But unfortunately, he did not put the date. The certificate he issued was in March. Then the case came in August. At that time, the person who was having the life certificate showed us and proved us that he was in Singapore or Malaysia. So we are helpless. Genuinely, he has given a life certificate, but unfortunately, the date where these transactions of land happened was on August. At time, August, this person who was given life certificate says, I was not at all in India. I was in Singapore or Malaysia, and showed the passport. So we are helpless. So just basically, he signed the life certificate with all the evidence, but forgot to write the date. So some of these small issues like this. So regulation of 7.7, certificate should be issued at most care and caution. Regulation of 7.7471 is ensure that the certificate is only when necessary and justified. And regulation 7.72, the certificate should include relevant details and be signed with a date and time. Unethical acts of advertising. All of you know, social patients directly, solicit patients directly, avoid direct or indirect, soliciting patients, and use the photograph, name, publicity, say, I am the expert in diabetes, I have cured thousands of people, I'll do this, that, don't give unnecessary, unethical publicity. Also refrain from highlighting achievements in advertisements. And we also go one step further, because today Prabhakar was citing an example. Even though you do a heroic surgery, you can be very happy that you have done, but don't show the patient in the press or media and say, this is the patient, I did the operation and he was better. No, don't do that. Even if you do a challenging surgery, it's better to not to expose the patient unless you follow certain legal problem. Formal advertisement to press. Allowed for starting a practice, changing a practice, changing practice type, or address temporary absence of resumption or suction. For example, if you are starting a new specialty, maybe you can advertise the hospital. Otherwise, you should not advertise benefits available for a large population interest. Ensure that patented innovations are accessible and beneficial to the broader public. And then again, do not run an open shop of selling medicines or surgical instruments. Do prescribe or supply drugs without exploiting the patients. Explicitly state proprietary formula and generic names in the drugs. Ensure transparency in prescriptions by listing both proprietary and generic drug names, because sometimes we are tempted to give a drug which is very costly compared to generic name. So those small things, if you do, it's good for the patient, and also you can show transparency in this. And then do not give, solicit, or receive gifts, gratitudes, commissions, or bonuses for patient referrals. This says 6.4.1. Then participating in fee splitting or refunding. Do not engage in the practice of splitting fees. These are the small things which, sometimes will lead to problems. Do not, again, prescribe or dispense secret remedial agency. Some people will say, I will reduce your obesity, I will cure HIV, and we don't know what medicines they give. So don't have the secret medicine and all that. You must ensure the patient's safety. You must also know what drugs you are giving, and you should give the bill. Also show the medicine what you are giving. Accountability is very, very important. Allows, in case of adverse reactions, you can see this is the drug, very well known, proved that the drug we are giving, so that we are safe. Do not aid or albeit torture. Again, do not practice euthanasia. In our country, euthanasia is not allowed. And if you want to remove the life support ventilator, you should not remove on your own. You should have a team of doctors, anesthetists, pulmonologists, and group of doctors before we remove the life support ventilators, etc. And then do not accept gifts, travel facilities, hospitality, or monetary grants from pharmaceutical industry, Avoid accepting any form of compensation or benefits from pharmaceutical company. Do maintain professional integrity. Ensure transparency. Conduct in research 6.8.1 research ethically and transparently, disclosing affiliations and funding sources. Because many times they say I've done research and I find this drug is good, but you have to document why you are doing. And misconduct, they do not abuse professional position, adultery, improper relationship with the patient, and engage in criminal acts, uphold the law and avoid any criminal activities, maintaining ethical conduct. Misconduct 7.1 to 7.2, maintain medical records. You see, for our purpose, we say you have to maintain medical record 3 years. But according to Clinical Establishment Act, you have to maintain record for 5 years. Always display your registration number clearly in the name board as well as in your prescription pad. And also it's a good thing, nowadays, today one of the senior pulmonologists wrote to our colleagues saying that whenever you give prescription, you take a Xerox copy of the prescription. Keep it for 5 years. It will be useful. And you should also have a CCTV camera and all the documentation procedure you should follow. And when you examine a girl or a young lady, you have always nurse by your side when you examine. So these are small tidbits which will help you. Because you may do it very sincerely, but the litigant may go into some action. We had 2-3 cases like that. So that's why I'm saying whenever you examine a girl, take utmost precaution, have your nurse by your side, and get everything explained to the parents or the husband, and then proceed. Then misconduct, sex determination. Again, sex determination, abortion, serious offense. Even the government of India, central government, state government, everybody insists you should not do the determination test, and with intent to abort female fetus, 7.6, adhere to laws prohibiting sex determination for the purpose of gender-biased abortion. And also don't perform illegal abortion. And unmarried girl, things like that, you will have to be very, very careful and consult the legal opinion from the persons. See whether he is really your parent or a husband. Sometimes, they'll bring somebody and say this is husband, and it may not be husband. So you'll have to document everything, verify all the documents, get everything cleared, and then only proceed. If you are in doubt, please consult the legal expert or send to us. We'll tell you what to follow. We have already given everything in the website, and it's worth to consult the experts, seniors people, before you do all sorts of illegal abortions when you suspect some illegal connections, etc. Misconduct certificates and reports. Issue untrue or misleading professional certificate such as life certificate, leave certificate, fitness certificate, and death certificate. Ensure all professional documentation is accurate and truthful. Any such registered medical practitioner who issues untrue, false, misleading, or improper certificate is liable to have his or her name deleted from medical register. See, for pressure or somebody known to you, some higher authorities may call you and say, issue leave certificate. Unless you see the patient, take utmost precautions. We already given everything, how to give leave certificate, how to do the fitness certificate, death certificate, etc. Kindly go through. Otherwise, I just give you a rough idea. Key points for life certificate. Proper identification. Verify proper valid documents such as Aadhaar card. Photographic evidence. Check recent photograph. Also, personal details, accurate information, collect accurate personal details, cross verification, check against existing records. He may have a passport, he must make an identification mark, and some attenders, some witness. Also, if you have a CCTV camera, and as I said, every document, like when you sign, you must have the date. And most important, physical presence. Whether you're giving life certificate or leave certificate, ensure seeker of certificate is physically present, and then only you can give. And you have to maintain records, accurate, systematic archiving. If you give a certificate, leave certificate, make a copy. Write in that copy the Aadhaar card number, ID marks, who was the witness. If possible, record it and document it. Date of certificate. Don't forget to put date and time issue of certificate. Decline to issue life certificate unless you have prior knowledge of the applicant and can vouch for their authenticity. Because many times, the land registration office, the brokers come and they say, we give you so much money, you kindly give the life certificate. Don't do that. Unless you know the person, don't try to give life certificate, because life certificate can be got from revenue officials, various other people, not necessarily the doctors. And our job is not to give life certificate. But definitely you can give life certificate if you follow all precautions, if you know that person very well and the family very well, and if you think you have taken all the precautions, you can give the life certificate. And then sometimes, the patient will come. One of the cases was interesting. She was wearing a cooling glass. Why? Because she underwent a cataract. And somebody came, had a respiratory infection, had a mask in her face. And the doctor could not, in the busy schedule, identify whether the photo and the lady is same. That lady had tried 3 years back, but this doctor gave the certificate after 3 years. These are small, incidents which I want to quote so that you be very, very cautious in giving these certificates. A leave certificate, purpose of medical certificate, permission for leave at work, education institute, especially court appearance. Somebody you give a certificate, so-and-so is having heart attack, so he has to undergo rest, things like that. And you should have all the necessary investigations and documentation why you are giving the certificate. And for periods of absence during inpatient on treatment, must be under treatment of seeing the RMP. Consider nature of work and diagnosis. Endorsement of certificates. RMPs can endorse treatment records after verifying. Endorsement based on patient's declaration and medical records. Issue only in official capacity. Ensure genuineness of treatment and records. Key points of leave certificates. RMPs shall not issue certificate for patients treated by different RMPs. You see, somebody has got treatment in Coimbatore. He comes to Chennai. He says, I have been taking treatment under so-and-so. Give me leave certificate. Don't give. He may bring the false records, false investigation. So you must be very careful, clarify, and then take the judgment and then give the certificate. Endorsement by government doctors only if officially ordered. And then acute minor illness, for example, abrasions, URI, viral fever. You give leave only up to 5 days. Extension, multiples of 5 days. Don't give blindly 30 days leave. 5 days, after 5 days he has to come. And again, you have to follow ID, Aadhaar card, whatever I said earlier. And chronic illness, example, low back, diabetes mellitus, hypertension. And then those things, you see the investigation, see the report, if necessary, see the experts report, and then leave recommendation in multiple of 5 days. And acute major illness like acute coronary syndrome, fatigue, fracture, tuberculosis, you can give up to 6 weeks. Again, you have to take the physical judgment, identify whether it's a genuine case, and give the certificate. And then diagnosis not made, major symptoms, chest pain, difficulty in the breathing, initial leave up to 5 days. Many people will come. I have chest pain. Then don't just like that give patient has got coronary syndrome or acute coronary attack unless you take ECGs. Many a time, to avoid court, they may come to you. You may not know. And extension based on clinical review and investigations. Attach relevant investigation reports and medical records. Make sure he may show you a ECG taken elsewhere. Maybe the ECG is from different patient. So make sure the same patient, same ECG. That time you will have to do personal judgment and then give the certificates. Record keeping, retain OP or IP entries for 5 years as per Tamilnadu Clinical Establishment Act. Certificates with the designation and seal of the treating place. Separate private and government practice seals. Fitness to join. Examine a day before returning to duty. Don't give fitness certificate. Many doctors, for sake of convenience, what they do, suppose if somebody comes, let us say, July 21st. July 21st, they say 15 days leave. And then they give a post-dated August 3, patient is fit to resume duty. They are giving the fitness in the July itself. But that should not happen. Only just 1 day or 2 days before the leave is expiring, you call them, examine them, and give fitness certificate. Maintain copies of all certificates. Adherence to guidelines ensures proper issuance and authenticity of medical certificates. Maintain integrity and trust in medical practice. Some people will come and say, give me that I am having chronic liver disease. I want to claim money from my company. I've got reimbursement for 20,000. So don't budge on to all these requests. Don't do that. Collect accurate information, name, age, gender, address of the patient, and death certificates. You must ask the details of the person reporting the death, accurate recording and place of death, identification proof, ID of the deceased and informant, application form completed and signed by the informant. Make sure you are treating a genuine case. One important caveat, whether it is institutional death or private death, the private clinic death, don't give death certificate unless you are the attending physician and personally observe the last breath of the patient. What happens? Sometimes the patient would have come to you 3 days earlier for diarrhea, and you would have treated. And the same patient's attender will come 3 days later, sir, this patient died. You innocently, ignorantly, what you do, you say the patient died of acute heart attack without seeing the patient. In those 3 days, you don't know what happened. In many times, you may come across certain mystery. For example, we had a case where an old man had a diarrhea in Tanjavur. About 2 days back only, he discharged. The patient's son came and got the death certificate saying that because the doctor treated, he knows that patient. So he gave the certificate, he died of heart attack. But finally, they found out, the other son found out he was killed by the other son. So, unnecessarily doctors will be into jail. Even the LIC claiming, recently we saw in a magazine, forgery. And unnecessarily doctors are in trouble. What for? You're not getting huge amount. But the person will convince, they'll do emotional drama, saying that, this, that, don't budge on to this. Always stick to your principles. Whether your own kith and kin, don't give death certificate. Many times it happens, if you are near to crematorium, everybody who comes to crematorium, they won't bring death certificate. They'll come to your clinic and say, my grandfather died, please give a certificate. Means you are sympathetically, empathetically, emotionally, you give certificate. Don't do that. And again, some people ask, sir, this patient died in a village and the crematorium needs a certificate. Crematorium needs a certificate. The patient's son himself can give an affidavit saying that it's a natural death. Nothing to do with us. Don't give the certificate by those pressure also. Don't issue death certificate based on cremation ground receipts. And misconduct, do not prescribe steroids, psychotropic drugs without medical indication. Only prescribe these drugs when justified and appropriate. And especially HL drug cosmetic act is a big thing. Some people will get addicted to certain drugs. They will come and insist. They may pay you more and give the drugs. Don't do that also. Again, do not advertise inappropriately. Follow ethical guidelines. I already told you, large signboard in the bus, back of the bus. A lot of people, they claim they are the specialists, they are cosmetologists. They may not have a good qualification to call them. And they say, I'm the best laparoscopic surgeon. They wouldn't have qualified. Nobody is, authorized to do those publicity and be careful in the publicity. If somebody sees this and they write to us, definitely we will call for action. Disclose patient secrets unless legally required. Maintain the patient confidentiality and only disclose which are legally mandated. And then surgical consent. It's a very important thing. All of us know we have to get the informed consent before you do a surgery. One of the interesting things sometimes happens is you want to do gallbladder removal, laparotomy. You got a consent saying that the patient is willing for a laparotomy. Suddenly, for laparoscopy, you are doing laparoscopy, suddenly you could not do laparoscopic removal of the gallbladder. You switch over to the laparotomy. Even then, you have to get the permission that you want to change the operation. Don't, because you got one permit for the laparoscopic gallbladder removal, don't go for laparotomy. You have to get this changing also from them. Again, if you have to give blood transfusion, get a separate consent, because blood transfusion also requires informed consent. You cannot give blood without the consent of the patient. So changing the operation, changing the treatment, everything should be explained to the patient and get the informed consent before you do that. And publish identifiable patient information without permission. Protect patient's privacy and only publish information with explicit consent. Even though a rash surgery is conducted, do not publish your photo as well as that of the patient. Very, very important. And one of the things which I see, it's not a very big offense, but this is all not good for a good practitioner. We have mobile phone and WhatsApp. When a patient comes and sits next to you, you should not speak to anybody else. Attend the patient sincerely. Otherwise, the patient will think, we are not taking care of them. And don't make the patient also bring the mobile phone. Sometimes the VIPs come, as you examine, the bell rings. It's not good. So don't allow mobile phones when you do consultation. And also, when you take a blood pressure, these things you should maintain. Calmness, sit quietly. All those, hurry and all, if you do, their readings will be different. And don't use touts for your promotion. No act of in vitro fertilization or artificial insemination and without informed consent from both partners. Sometimes, over enthusiastically, you shouldn't get into the problems. Why we do all these things? Why unnecessarily? Trust and confidence. This is the foundation of patient relationship. You should maintain patient relationship. Patient-physician relationship is the key for communication. Ethical behavior builds trust and confidence between the patient and the healthcare provider. Public trust in healthcare system. Upholding ethics enhances the credibility and reliability. And then patient safety and well-being, ensuring optimal care, minimal harm. Again, adherence to ethical codes. I already told you what are the codes. Healthcare professionals serve as influencing peers and future practitioners. Legal and regulatory compliance. Avoid legal repercussions. Maintaining ethical standards help in achieving. Regulatory standards. Compliance with ethical and regulatory standards ensures that legitimacy and accountability of medical practice. And continuous improvement, fostering ethical culture, gives you credibility. Encouraging reporting conduct supports a culture of openness, mandatory of reporting to authorities, and transparency. Again, the sustained professional reputation leads to credibility, career longevity. Practitioners know their ethical behavior and more likely to enjoy long, successful careers. And then moral fulfillment, work environment. You should have an ethical workplace, foster respect, collaboration, and positive atmosphere. Reduce legal and professional risk, professional safeguards, continuous professional development, I already told you, commitment to excellence, leadership opportunities. When you do ethical behavior, it opens the doors of leadership roles and opportunities within the medical community. Every doctor is a leader in the community because he only guides people what to do, what not to do, what to eat, what not to eat. So every doctor, in my opinion, is a leader. Develop the leadership quality, do it with sincerity. And then documentation, I already told you, I repeat again, maintain accurate, comprehensive patient records. Provide records within 72 hours upon request. As I told you, even the prescription OP chip, you can take a Xerox copy, keep it for 5 years. And then do not engage in improper relationship with patients. Avoid any actions that could be perceived as professional misconduct. Communication and transparency. Research and innovation. Obtain necessary permission and ethical clearance before research. Even if you want to do research, you have to follow the ethical guidelines. Respecting other physicians. For example, many times I see the patients come to us, the litigant come to us with clear medical terms. We come to know the neighbor or the person who is practicing in your area only gives all these ideas. So please respect your colleagues' opinion. And then patient-physician relationship is important. Same thing, physician-physician relationship is important. Because many problems can be avoided if you have good understanding. And if a physician gets into a problem, you, the neighboring physician, should rush and then help the physician. That sort of unity you should have. That is why in IMA and all, we have a medical emergency team, crisis committee. So this committee makes people the physicians to come together. When you have a problem today, their neighbor can have a problem next day. So that sort of understanding between the physicians is important. You learn to respect the physicians, and you should have physician-physician relationship, and should develop a good environment so that you get collaboration ultimately leads to better patient care. If you do that, for example, if you are in a trouble, in the crisis, you just tell the nurse, all the doctors will come to you for your rescue, and as a team, you can save the patient. So that way also it's good. In emergency also, if you start doing this, cultivating this habit of helping the neighboring physicians and doctors, you can save patients, and credibility also goes, and this atmosphere is a healthy atmosphere. And then I already told you, retain copies of all prescriptions, physical or digital. Refrain from using advertisements and all I told you. Ensure CCTV camera surveillance. Examine female patient in the presence of attender. And importance of patient communication. Communication. You always, be careful. In spite of you being careful, there may be some problem. But when there is a problem, you will have to talk to the patient politely without getting angry. Because when the patient is in a problem, definitely he may talk very angrily, use rough words. Don't lose your cool. Be calm. When you have a problem like this, explain to the patient why it happens. Because we are not God. We cannot save every patient. See, there is a slight difference between the negligence and the complication of the patient. Every patient may die because of the complication, not because of negligence. But the patient point of view, they always say when the 20 years you are a sincere patient, but something happens, they blame the doctor. So what you have to do, have a proper communication. Tell them, explain each and everything, even before you do a surgery, before you undertake a serious treatment. Say, this is a problem, you may get a problem like this. Don't say unnecessarily, you will be all right. You have to say you will be all right to create a confidence. And when you do a surgery or a major problem, you may say 1 in 100, 1 in 1,000 may get this complication. Like that, you explain and then take the treatment. For everything, communication is very important, and you must learn the art of communication. Many of us do not talk to patients very coolly, comfortably. So that you have to do. So communication reduces patient anxiety and psychological distress, improves symptom resolution, mood, and physiological outcome like blood pressure. Studies show patients being complaint is often about communication problems and not clinical competency. Demonstrate respect towards the patient. Use a mix of open-ended questions, gather information. When the patient asks questions, politely answer them. And even if you think it's silly, it's better to answer them, so that they will get happily, take the treatment. So I always say, listen to learn to listen. Every patient is a book for you, is a professor for you, for your experience. So learn his complaints. So listen to learn and learn to listen. Listen actively and respond appropriate questions. Even they may ask so many questions, spend some time, answer them. Involve patients as partners in decision. We call it a shared decision making. It is not the decision by the doctor. It is a shared decision between the patient and the doctor. We explain what it is and then take a decision collectively. So this is called shared decision that you have to do. Respect patients' individual values and concern. And a special caution for obstetricians. You see, we get a lot of obstetrical cases, lady doctors, poor lady doctors, they do day and night service. And if one delivery comes, they may sit with the patient for 24 hours till the patient delivers the baby. But in those situations, they get so many problems. You will have to talk to them very, very carefully and clearly. Sometimes the patients, may ask you so many questions, and you angrily say something that may lead to problem. For example, one of them said, I would like to undergo cesarean section. Don't mind. Please take me to cesarean section. You must explain to them this natural delivery is possible. We can wait for 3-4 hours and then decide. And if the patient still insists, you get the thing in writing and then do the procedure. Another thing which I saw in many of rural doctors, obstetricians, when the patient comes for a DNC, they themselves do give a IV drugs anesthesia and then do the DNC without anesthetist. Why? Because the patient has got only 1,000 rupees and he cannot afford for an anesthetist. So just to reduce the cost, I have given the IV anesthesia and did the DNC. Don't have empathy, sympathy like that. Because if you get into complication, the same patient will sue you. And if they cannot afford to do the DNC, let them go to government hospital. We have got enough facilities in the government hospitals. Lot of facilities, lot of benefits they get in the government hospital for women. So don't ever do any procedure without anesthetist, especially obstetricians. Please make a note, because we got 4 or 5 cases like that. A senior obstetrician says, I am very much experienced. I know how to give IV, and then I did the DNC. So many 1,000 DNCs I did. 1,000 DNCs was problemless. The 1,001 was a problematic, and the lady is in problem. So don't do anything without anesthetist. Likewise, now we see lot of people, obstetricians, they do ultrasound regularly. They are very good. Every day for follow-up, when they come for antenatal checkup, you do ultrasound, no harm. And in case, if you think there is a congenital anomaly, you send the patient to the fetal anomaly specialist. In routine, many obstetricians send the patient for fetal anomaly for the specialist. And if you do an ultrasound and say no fetal anomaly, and if the baby is born with the defect, for example, one limb is not there in a baby, because of the position and things like that, the obstetrician was explaining. So that is not our cup of tea. So there are congenital fetal specialists. Sramakandan usually says all the obstetricians just send everyone at the appropriate time for a fetal anomaly specialist ultrasound. You know to do ultrasound, but you cannot detect the fetal abnormality if you're not trained. And especially when you say ultrasound normal, no fetal anomaly, and the patient comes like this, you are in soup. And you may say in every town we do not have a fetal specialist. But at least in the writing you say, I suggested to go for a fetal consultant, and patient did not go. It is not your fault. Then you can escape. And if you are not confident, don't write in the ultrasound report, no fetal anomaly. You can say, baby is grown, things like that. Regarding the fetal anomaly, I suggested for a fetal consultant, specialist, patient did not go. That's not your fault. But if you write in the ultrasound, no fetal anomaly in the report, that's not correct. So you avoid that. Again, avoid interaction with quacks. Many doctors, they think they can get good practice by having quacks in their association. So that please don't do. A quack, you should expose quacks. Now, Tamilnadu Medical Council has got proactively, we have appointed a lawyer also. If there is any quackery in your area, please tell us. We'll take action, and we won't give your identity, because quacks will endanger the life of community. It's not good. So we are having anti-quackery principle. And if you have any quacks, contact the local AMA group and then write to us, and we will not disclose the identity, and we want to abolish quackery. And please, if the quacks refer cases, don't encourage them. So don't have any connections with quacks. And then I already told you all that. Respect autonomy, professional integrity, ensure transparency and honesty, promote patient welfare, and then avoid self-promotion, avoid conflict of interest, prevent exploitation and misconduct, adhere to legal and ethical protocols whenever you issue any certificate. And of course, if you don't do all that, definitely disciplinary action and punishment will come. You must understand all professional misconduct can lead to disciplinary action. It can be removal of your name for 6 months or 5 years according to your crimes. Be aware that violation standards can result in legal measures. Cooperation with investigations by medical counsel. Suppose if you get some legal notice, you come and explain, because we are here to guide you. And whenever you do a legally not advised things, you have to come to us and don't refrain from coming. And there are people who say, I'll go to the court. But we are here to guide you and help you to avoid legal problems. So prevention is better than cure. So if you have any problem, please contact the legal expert. Our Tamilnadu Medical Council will given the email ID. You can contact us whether we can do this, that, like that. Consequences: possible removal of the from the medical register. Serious breaches can lead to removal from the medical register, leading to ban on the practice. Before any question, again, I want to give the disclaimer. Whatever I said so far, it's a general principle to make you, aware of what are the common ethical principles, what are the legalities, what are the good tips for practice, what are do's and don'ts, so that you can do the private practice and very safely and also calmly. This program, what we have talked, will be in the website of Tamilnadu Medical Council. And as our Prabhagar and the Srinivasan and Sivaramakannan wanted, this can be repeated, because now we got only 1,300 people in attendance in the Zoom, and there are more than 50,000 RMPs. So everyone need to be educated, and we will also send this video link to your WhatsApp groups. You can refer, or you can circulate to many people, because in WhatsApp we have the habit of circulating and forwarding. Forward this useful video so that everybody will understand and they'll have a good, safe practice. I am available for any questions. Thank you, Dr. Sivaramakannan, Dr. Prabhagar, Dr. Srinivasan, all our team, Ramanujam, Dr. Kamaraj, Dr. Jitendra, all the team, especially Subarna is doing our CME program regularly with credit hours, Sudha, Ramasamy and legal team, we are all there to help you, and we want to make you a peaceful practice your own. Thank you very much.
Good evening, everyone. Our conveners has explained everything in detail. I wish to share some few points. இங்கே வந்து எங்கள் மெடிக்கல் கவுன்சில் டிசிப்ளினரி ஆக்ஷனுக்கு வர கம்ப்ளைண்ட்ஸில் 1/3 வந்து பிகாஸ் ஆஃப் ஈகோ கிளாஸ் பிட்வீன் பேஷண்ட் அண்ட் த டாக்டர். ஸோ பேஷண்ட்டை வந்து பேஷண்ட்டு இல்லை பேஷண்ட் அட்டன்ற ரெஸ்பெக்ட் இல்லாமல் பேசினார் அப்படின்னு சொல்லிட்டு அவங்க ஈகோவை ட்ரிகர் பண்ணி விட்டு they made complaint unnecessarily. ஸோ அதுக்காக வந்து அவங்க வேலையை விட்டுட்டு டென்ஷனாக அங்கேருந்து இங்கே ட்ராவல் பண்ணி they are attending disciplinary meetings. So always communicate very well in a good manner, sympathetically and empathetically. It will avoid most of the litigations, number one. ரெண்டாவது வந்து எந்த ப்ரொசீஜர் பண்ணாலும் go with கன்சர்ன் இல்லாமல் பண்ணாதீங்க. ஃபார் எக்ஸாம்பிள் வந்து இப்போ பேஷண்ட் எனக்கு ரொம்ப தெரிஞ்ச பேஷண்ட்டு அவங்களோட பையனுக்கோ பொண்ணுக்கோ ஒரு ப்ளூரல் புலிடு ஆஸ்பிரேஷன் பண்ணணும். இட்ஸ் எ சிம்பிள் ப்ரொசீஜர். கன்சர்ன் இல்லாமல் பண்ணி பாசிட்டிவாக, அதாவது நல்லபடியாக முடிஞ்சிச்சுன்னா ப்ராப்ளம் இல்லை. பட் அதே நேரத்தில் இஃப் பெயின் ஷாக் கொலாப்ஸ்ட் இந்த மாதிரி ஒரு அன்வர்ட் ஈவெண்ட் நடக்கிறப்ப ஏன் கன்சர்ன் இல்லாமல் பண்ணணும் அப்படின்னு ஒரு ப்ராப்ளம் வரும். ஃபார் எக்ஸாம்பிள் சின்ன ஒரு பாயில் ஒரு ஐஎன்டி பண்ணுறோம், இஃப் எவ்ரி திங் கோஸ் ஸ்மூத்லி அப்படின்னா ஒன்றும் கிடையாது. அதுவே வந்து பேஷண்ட் வந்து ஒரு செப்டிசிமியா மறுநாளோ ஏன்னா அதுவாக செப்டிசிமியா போனாலும் நாம் பண்ண ப்ரொசீஜர்னால தான் வரும். நீங்கள் கன்சர்ன் இல்லாமல் ஒரு இந்த மாதிரி பண்ணிட்டாரு அப்படின்ற கம்ப்ளைண்ட்டும் வரும். ஸோ வாட் எவர் யூடிய சிம்பிள் ப்ரொசீஜர் கோ வித் கன்சர்ன். அடுத்து லைஃப் சர்டிஃபிகேட். சார் சொன்னார் லைஃப் சர்டிஃபிகேட் கொடுக்கணும் அப்படின்னா இந்த இதெல்லாமே இப்போ டாக்குமெண்டேஷன், ஐடென்டிஃபிகேஷன், ஆள் நேராக பார்க்கணும், சைன் வாங்கணும், எல்லாம் பண்ணார். நீங்கள் எல்லாம் பண்ணாலுமே ஏமாத்துற மாதிரி சில கம்ப்ளைண்ட்ஸ் வந்துருச்சு. இங்கே எப்படின்னா ஒருத்தர் வாக்கின் வராரு, அவர் ஐடென்டிஃபை பண்ணுறாரு, டாக்டர் பண்ணுறாரு, ஆதார் கார்டு காட்டுறாங்க, எல்லாம் பார்த்துட்டு சரி ஒரே மாதிரி இருக்காங்கன்னு சைன் வாங்கிட்டாங்க. பட் என்ன பண்ணால் ஆக்சுவலாக அந்த ஆதார் கார்டு வந்து அவர் பிரதரோடது. 2 பேரும் ஒரே மாதிரி இருக்கிற ஆள், அண்ணன் தம்பி ஒரே மாதிரி இருக்கிற ஆள்னால நானே வரல, எங்கள் அண்ணே வந்தார், டாக்டர் வேணும்னே காசு வாங்கி போட்டார் அப்படின்னு லிட்டிகேஷன் ஆயிடுச்சு. ஸோ இப்போ என்னோட கன்சர்ன் என்ன அப்படின்னா, லைஃப் சர்டிஃபிகேட் கொடுக்குறதுங்கிறது நம்மளோட பேசிக் டியூட்டி கிடையாது. ஸோ ட்ரை டு அவாய்ட் இன் எனி சர்க்கம்ஸ்டன்சஸ் டு கிவ் லைஃப் சர்டிஃபிகேட்ஸ். ஏன்னா ஒரு ஒரு 15 டிசிப்ளினரி கேசஸ் வந்ததுன்னா அதில் அட்லீஸ்ட் 1 or 2 கேசஸ் லைஃப் சர்டிஃபிகேட் கொடுத்ததுனால தான் கம்ப்ளைண்ட் வருது. ஸோ அதுவும் எவ்வளவுன்னா ஒரு 100 rupees 200 rupees வாங்கிட்டு லைஃப் சர்டிஃபிகேட்டுக்கு அவங்க அலைஞ்சிக்கிட்டு இருக்காங்க நிறைய டாக்டர். ஸோ டோன்ட் கிவ் லைஃப் சர்டிஃபிகேட்ஸ், என்னோட ஹம்பிள் ரெக்வஸ்ட். அதே மாதிரி மெடிக்கல் லீவ் வந்து நம்ம 5 days மினிமலுக்கு 5 days கொடுக்கணும்னு சார் சொன்னார். தென் 5 daysக்கு 5 days கொடுக்கலாம். எல்லாம் கொடுத்தாலும் ஏற்கனவே சார் சொன்ன முருகன் சார் சொன்ன மாதிரி லைஃப் சர்டிஃபிகேட்டுக்கு டேட் போடாமல் டாக்டர் கொடுத்துட்டு இன்றைக்கி வந்து லிட்டிகேஷனில் ஸ்பெண்டிங் மோஸ்ட் ஆஃப் த டைம் டு ரெக்டிஃபை தட் ப்ராப்ளம். அது மாதிரி மெடிக்கல் லீவ் கொடுக்குறப்ப பேஷண்ட்டோட சிக்னேச்சர் வந்து யூஸ்வலாகவே யாரும் போட மாட்டாங்க. பேஷண்ட்டோட அட்டெண்டர் கொண்டு வருவார், கொண்டு வந்து சார் ஃபிட்னஸ் கொடுங்க சார், லீவ் கொடுங்க சார்னு கேட்பான். ஸோ ஃபிட்னஸ்னாலுமே பேஷண்ட்டோட சிக்னேச்சர் இல்லாமல் நீங்கள் தராதிங்க. தயவுசெய்து அதை வந்து என்ஷூர் பண்ணிக்கோங்க. ஃபிட்னஸ் வந்து பேஷண்ட் சிக்னேச்சர் இல்லாமல் அப்படியே ப்ரொடியூஸ் பண்ணுவாங்க. தென் அகைன் இட் வில் கம் டு அஸ் எ ப்ராப்ளம். ஸோ அதனால் பேஷண்ட் சிக்னேச்சர் இருக்கான்னு பார்த்துட்டு கொடுங்க. அப்புறம் வந்து பேஷண்ட்டுக்கு வந்து செலவை மிச்சம் பண்ணுறேன்ட்டு நெசசரி இன்வெஸ்டிகேஷன்ஸ் பண்ணாமல் இருந்துடாதீங்க. டூ நெசசரி இன்வெஸ்டிகேஷன் டு எஸ்டாப்ளிஷ் த டயக்னோசிஸ். ஏன்னா நாளைக்கு வந்து நான் இந்த டெஸ்ட் பண்ண நான் ரெடியாக இருந்தேன், டாக்டர் பண்ணாமல் எங்களை வந்து இவ்வளோ மோசமாக்கிட்டான்னு தே வில் கம்ப்ளைண்ட் யூ. அண்ட் ஃபைனலி டாக்குமெண்ட் எவ்ரிதிங் வாட் எவர் யூ டூ. பிகாஸ் என்னென்னா இங்கே ஒரு கம்ப்ளைண்ட் வந்தது, ஒரு பேஷண்ட் இம்மீடியட் போஸ்ட் ஆப்ரேட்டிவ் பீரியட் டைட் ஆஃப் பல்மனரி த்ராம்போம்பலிசம், மேசிவ் பல்மனரி த்ராம்போம்பலிசம் கம்ப்ளைண்ட் எல்லாம் வந்தது. த டாக்டர் வாஸ் எஸ்கேப் பிகாஸ் ஆஃப் ஹி கேவ் லோ மாலிகுலர் ஹெப்பாரின் ப்ரீஆப்ரேட்டிவ்லி. அதை டாக்குமெண்ட் பண்ணியிருக்காரு. ஸோ இப்போ நிறைய நேரம் என்ன பண்ணோன்னா ஓரல் நம்ம வந்து இது சொல்லிட்டு போயிடுவோம், அட்வைஸ் லோ மாலிகுலர் ஹெப்பாரின் போடுங்க டாக்டர், டியூட்டி டாக்டருக்கோ இல்லை ஸ்டாஃப் நர்ஸ்க்கோ சொல்லிட்டு போயிடுவோம். அவங்க டாக்குமெண்ட் பண்ண மாட்டாங்க. ஸோ அதனால் வாட் எவர் யூ டூ ட்ரை டு டாக்குமெண்ட். தேங்க்ஸ் ஃபார் த ஆப்பர்ச்சுனிட்டி.
Hope the CME was useful for everyone. So we thought of making it as an interactive session. Maybe we have got a lot of questions. We'll collect the questions, and in the second part of the CME, we will give you the appropriate answers. Thank you very much.
ஆமா